Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections into the hip joint. So as with my previous video about imaging the anterior hip joint, I tend to have the patient lying in a supine position. Depending on body habitus, you may want to accentuate this a little bit by dropping the end of the bed down so that it further extends the hip joint. It therefore brings it more superficial. Having the patient in this supine position is much more stable when undertaking the injection. So this tends to be my approach. I use a curvilinear transducer which gives a broad field of view, and because of this I can see the hip joint much more easily. Also, the transducer tends to have a lower frequency profile, so with the better penetration you can see the structures. I tend to do the injection in a longitudinal or long axis orientation and use an in-plane approach. Essentially what we're aiming to do is to bring the needle down into and around the femoral neck. That's because the joint capsule overlaps this area, and once you're in this space, as you inject, you will see the fluid run proximally over the femoral head. An alternative might be to do an out-of-plane approach directly over the hip joint. However, because of the depth of the structure, I wouldn't recommend this because it may be much more challenging to achieve. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.